The third experiment is about effects of administration route on drug effects. The objective of this experiment is to observe the difference of drug effects caused by different administration routes. The animal for this experiment is also mouse. The drug is nicotinamide. This drug has another name, Karami. It is one respiratory stimulant because its stimulant effects on CNS, especially respiratory center. Because nicotinamide, you don't study this drug from pharmacology theory class. So let me introduce this drug in detail. Just now I said, it's one of respiratory stimulants, analeptic, because nicotinamide, when it is used at therapeutic dose, it can stimulate respiration, and this effect is short and modest, make breathing faster and deeper. This effect, the mechanism is related to these three mechanisms. Because nicotinamide can directly stimulate respiratory center, make breathing faster and deeper. And it also related to reflex-mediated stimulation of respiratory center by stimulating chemoreceptor in carotid body. And this reflex, this mechanism, it is relatively weak. Nicotinamide also can increase the sensitivity of respiratory center to carbon dioxide. So it mainly acts on respiratory center. At the therapeutic dose, based on this effect, this drug, nicotinamide, in the clinical practice, it mainly used to treat central respiratory depression caused by some disease, such as cardiac disease, or caused by some drug toxicity, like morphine. Do you still remember morphine? It is one analgesic. Act on CNS, morphine can lead to respiratory depression. Maybe some addicts died from respiratory depression caused by morphine. One day you will have one experiment about morphine respiratory depression. That day you should administer morphine to the rabbit and then observe the respiratory depression caused by morphine. When breath of the rabbit become slower and slower, you can administer nicotinamide to save the rabbit's life. Make the breath of the rabbit recover normal conditions. It is effective to correct the respiratory depression caused by morphine, but the other effect caused by morphine, like meiosis, nicotinamide, it is not effective. But remember, nicotinamide only it is effective to correct central respiratory depression. It is not effective for peripheral respiratory depression. And only use the nicotinamide at therapeutic dose. When it is used in large dose, nicotinamide cannot only stimulate respiratory center, it also can stimulate the whole cerebral cortex, stimulate the CNS, the whole CNS. At that conditions, maybe it will lead to some toxic effect, like convulsion, even dies. Notice, actually, nicotinamide has a relatively short half-life. For humans, half-life of nicotinamide is about 10 minutes. It's really short. But in some conditions, maybe it is necessary to administer nicotinamide for several times. But pay more attention about this short half-life. The repeated administration of nicotinamide maybe lead to a cumulative concentration is too large. It is similar to use nicotinamide in the large dose. So nicotinamide maybe lead to tachycardia and increase the blood pressure, even convulsion, even death. So when you have experiment of that morphine to observe the respiratory depression caused by morphine, and then you administer nicotinamide to save the rabbit's life, at that conditions, that time, your teacher will tell you, don't inject nicotinamide to the rabbit too fast. Just intravenous inject nicotinamide slowly. Try to avoid the sudden high concentration of nicotinamide in the rabbit's plasma. Try to avoid convulsion caused by nicotinamide, even death. So during this experiment, you should observe the behaviors, activities of the mice, especially convulsion, this phenomenon. Because we administered nicotinamide at a relatively large dose to the mice and observe this effect caused by nicotinamide. Now, maybe you don't know what is this convulsion. Actually, in the past, I explained what is convulsion. It usually caused by over excitement on seeing eyes. The whole cerebral cortex are too excited. So every piece of skeletal muscle in the body will contract, over-contract. So over-contract. So lead to that symptom is caused by convulsion. Now, please watch this video to show you convulsion on mouse. This is normal conditions. Now, it caused by muscle changing, every piece of muscle over-contract. This is convulsion, caused by over-excitement of seeing eyes. And then, over-stimulation of seeing eyes finally can convert into depression, even death. And, when this drug administered by different administration route at the same dose, the amount of the drug absorbed into the blood, maybe they are different. So the drug will show different stimulant effect on seeing eyes. If it is not enough to show convulsion, maybe the mice will jump. Okay, now look at experimental procedure. Take 3 mice and observe their normal activities and weigh their body weight and record the body weight on the paper and mark them one by one and give their number. So maybe this is number 5. This is number 6, number 7. And then administer drugs according to their body weight. Nicotinamide is done at the same dose, 0.1 milliliter per 10 gram, their body weight. For mouse number 5, you can administer nicotinamide by subcutaneous injection. For number 6, the rules is intragastric administration. It is similar to oral administration for humans. Number 7, you should administer nicotinamide by peritoneal injection. And then observe carefully. Record their behaviors, especially observe whether the mice show convulsion, and record the required time to show the symptoms after administration. Just now I mentioned, if the concentration of nicotinamide, the total amount of nicotinamide in the body of the rabbit, of the mouse, it is not large enough. Maybe it just stimulates respiratory center, make up breathing faster, and maybe the mouse also just should jump. That also is stimulant effect caused by nicotinamide. And if this dose administered and absorbed into systemic blood circulation of mouse is large enough, maybe it also lead to death. Please watch this video. It shows you how about the process of this experiment. Take 3 mice and weigh their body weight. It can be considered as 23 grams, according to rounding value. And then apply picric acid yellow solution at the different local area of the back of the mouse. This is number 5. Take another one. This is 20 grams. Give number. This is 6. Another one. This is 24 grams. Give it 7. Prepare the drug with an injector. These 3 mice all can be administered with 1 injector. So you can prepare the total amount, the required amount of the nicotinamide in 1 injector. Adjust the volume. For number 5, you should administer subcutaneously. Maybe you can choose a spike. And of course, you also can administer subcutaneously at the carotid spike. Number 6, you should administer by intragastric administration. Now, you can guess what the differences among these mice. They administered these drugs at the same dose by different rules. This one administered peritoneally as the lower abdominal part and put them in the cage. Observe their activities. If this is a jump, just stimulate seeing eyes relatively mild. Now, changing of muscle as convulsion and record their symptoms on the time. Now, this is one result. For number 5, the behaviors of the mouse, it is convulsion. The latent period to show this convulsion for number 5, it is 4 minutes, 12 seconds. You know, number 5, you administer nicotinamide by subcutaneous injection. But for number 6, its behaviors is jump. It means its stimulating effect is relatively mild, but this number 6, it also has hematemesis, bleeding in mouse. Actually, bleeding from mouse because of overcontraction of every piece of muscle. The mouse, maybe it bites its own tongue. That's why bleeding from mouse. This is number 6, administered by intragastric administration. So the latent period to show these symptoms is 7 minutes 35 seconds. And number 7, this mouse show bleeding in mouse, and it also show convulsion. Finally, it is died. And the latent period to show convulsion for number 7, it is 1 minute 20 seconds. Now, compare these results. Actually, these 3 mice, they show different stimulant reactions. Number 7, it is the most serious. And number 6, it is the mildest. And for the number 7, the latent period, it also is the shortest. It means by peritoneal injection, the drug absorbed relatively faster, maybe fastest, and also is most. But number 6, it is similar to oral administration, so the absorption is relatively slower and less. So that's why number 6 has the longest latent period, and the stimulant effect and also is the mildest. So based on these results, can you explain? Actually, just now I explained a little. These mice are administered nicotinamide by different routes of administration. Do you still remember these 2 figures? Different routes of administration have different rate and extent of absorption. This figure shows you what's the difference between them. This is caused by oral administration. This is subcutaneous injection. Different administration routes, they have different Cmax and peak time. So that's why the drug concentration in the plasma, they are different. So they induce different pharmacological effect. So based on this, can you make a conclusion about this experiment? It's very easy. It means administration rules have effect on the drug effects. In detail, peritoneal injection leads to a relatively early effect. The drug effect take onset relatively early and faster. But secondary is subcutaneous injection. Intragastric administration is the slowest and mildest. Okay. Now, based on this slide, we can review administration rules. Actually, you have studied from pharmacology theory class. I have taught you. I think maybe you still remember, but someone maybe forgot. These different rules of administration, they have different advantages and disadvantages. Like oral administration, it is the safest compared with others. It also is the most common and convenient and economical route. But it has a limited absorption, especially for some drugs. Maybe its absorption can be affected by food intake. And drugs, because of after absorption, because of portal vein between the intestine and the gut, maybe this drug after administration orally may be metabolized before systemic absorption. So, it has relatively obvious first pass elimination. That's why bioavailability of oral administration it is relatively less. Intravascular administration. This route has no process of absorption. It can induce immediate effects. That's why intravascular injection is very common in some emergency. And of course, it always requires a strict aseptic technique. You need nurse to help you intravenous injection. An intramuscular injection. This absorption, it depends on drug diluents. Sometimes it induces intramuscular hemorrhage at the local area of injection. It also leads to pain. And it is suitable if drug volume is moderate. Subcutaneous injection. Absorption, it also depends on drug diluents. And it is suitable for slow release drug. And it also, the volume of solutions, of the drug solutions, it is also limited. It is not suitable for the drug in large volume. Transdermal injection, transdermal administration, absorption is relatively slow and sustained. This route can bypass first pass elimination. It also is very convenient and easy to be accepted by the patients. But maybe some patients are allergic to patches. It can cause irritation. And the drug must be highly lipophilic. Rectal administration. Absorption, it is relatively erratic and variable. This rules also partially bypass first pass elimination. and drugs may irritate the rectal mucosa, and it is not a well-accepted route. Inhalation. Absorption of inhalation is very rapid, so it also leads to immediate effects, but only limited for some cases. The target organ of this route is almost the respiratory system, especially lungs. It has relatively fewer systemic side effects, but pay attention. Systemic absorption also may occur. The patients, maybe they have difficulty in regulating dose. Sublingual administration. This route also bypasses first-pass elimination and bypass destruction by stomach acid compared with oral administration. But similar to transdermal, these routes also limit for some drugs with high lipid solubility. Okay, actually, that's all for this time experiment. So let's review. There are 3 small experiments for this time. You should take, if you have this experiment in life, you can take 7 mice together, and then weigh them body weight and give numbers to them one by one, and record their number and body weight. Observe their normal activities. There are 2 mice. You should administer pentobarbital in different dosage form. There are 2 mice for barium salts experiment, 3 for different routes of administration of nicotinamide. Now look at this. The first experiment is about drug dosage forms in mucilage or solution. Administered the drug pentobarbital at the same volume by intragastric administration. You should observe the activity is normalizing reflex. You should record after administration when the mice lose normalizing reflex. And the second one is about the physical-chemical property. You should administer the same dose of barium salts by peritoneal injection. Just one is barium chloride, one is barium sulfate. They have different water solubility. This barium sulfate, it is insoluble in water. So this is one of physical chemical property of the drug. You just observe the activities of the mice before or after administration compare. Actually, one is dead, caused by barium chloride. One is still alive. This is caused by barium sulfate. And the third experiment is about administration rules. You should administer nicotinamide at same dose by different rules. For number 5, subcutaneous injection. Number 6, intragastric administration, peritoneal injection for number 7. And observe the stimulant effects caused by nicotinamide, like jump, like convulsion, even dice. Oh, these 3 experiments, they involve the content of pharmacokinetics, especially about absorption. Different dosage forms of the drug, like mucilage and solution, they have different velocity of absorption. So, like this administration route, different routes, they also have different rate and extent of absorption. So, after administration, they have different Cmax and Tmax. Remember? Cmax means the maximum concentration of the drug in plasma. How about the drug concentration levels in the body? How much the drug absorbed into systemic blood circulation? It also affects the Tmax. You know what is the Tmax? Peak time. It means after administration by any routes, the required time to reach to the highest level of blood circulation, blood concentration of the drug. So actually, different Tmax and Cmax, they have different absorption. So finally, this result exhibits different pharmacological effects because they lead to different latent period. They also lead to different duration of the drug action. Usually, it is just lead to quantitative change, quantitative difference between the different factors. And even sometimes, it also leads to qualitative difference, like this physical chemical property, barium salts. Barium sulfate, it is insoluble in water. That's why this drug cannot be absorbed. So, barium ions cannot lead to toxic effect to the mice. So, you should know well this knowledge of pharmacokinetics related to the drug factors. It will guide you to use the drug to get the ideal therapeutic effects and avoid some toxic reactions. Of course, you should fill the results into the table. And based on these questions, analyze and discuss, explain the results. Yeah, of course, maybe during your experiment, some student or some group cannot get the ideal therapy, the ideal experimental result. You should also analyze why. For this 3 small experiments, maybe like benzoyl in different dosage form, mucilage or solution. Some students got the result is just the opposite. So can you analyze why? Actually, because you are students, your skill of injection of this operation on the animals are not very proficient. So maybe the volume of the solutions, the drug solution, is not accurate. So finally, the drug administered to the animals is not the right, not correct. So it's wrong result maybe. And sometimes maybe it also can be caused by animals. Don't forget individual variation from individual factors. Okay, actually, this is a very special style for you experimental class, just because of epidemic. Hopefully, we can get rid of this epidemic as soon as possible. So you can come back the campus and have your experimental class and you should deal with these animals. And in the future, you will work as a doctor or pharmacist. Before you operate on your patients, you first need to practice on the animals. So hopefully you can come back earlier and sex these animals. This give their lives to the medical cause and our experimental teaching, your study. And now I also thank you for your attention to my lecture. Thank you.